We really have reached that phase where we have tested out a number of the important principles and processes of the sector-wide approach. And we have reached an inflection point, an important pivot, where some of the important mandates at the beginning around, working ourselves out of the job, institutionalizing a lot of these processes within different agencies and the ministry. And more importantly, prototyping an important intervention that allows us to bridge that gap between processes and outcomes. And I think this is what I am most excited about. I'm quite excited that even within the sector-wide coordination office, we have more staff that are seconded from government institutions. I'm excited because we have been very intentional about ensuring that whether it is the annual operating plan process or we are co-chairing a TA committee or co-chairing a technical working group, it is government-led. It is folks within ministries, departments, and agencies truly driving the agenda and mandate of government. In addition, we are making significant investments in the risks related to building fiduciary systems, in working a bit differently with development partners so that we test government systems as well. And I think this is really what institutionalization looks like, right? I think once we are baked in terms of important processes, what remains is now being able to demonstrate that these processes indeed will help to amplify impact on health outcomes, right? We have seen MAMI as a case study, and during the last joint annual review, there's an association between the onset of MAMI, what we have done to help to either, localize the issues in 172 local governments, engage states to prime them around context-specific interventions to address maternal and neonatal health issues, engaging partners to support crowding in resources, the agenda setting around maternal and neonatal health. So lots have happened there, and that has been associated with, reduction, facility-based, of, maternal and neonatal mortalities in terms of case fatalities by 17 and 10%. Now, once again, this is an association, and I think this is, for me, another important lesson, right? That in our research and curating of knowledge products, we now have to make sure we are more intentional about the attribution aspect of things, that we design it in that phase. So I think that's one important piece. The second is that to the extent that we have been able to have early gains, I think we're now at that phase where we should be thinking through scaling up, right? So doubling down on the 170 local governments, but also, mobilizing additional resources to scale up. I think another important piece of this is that we speak a lot about one plan, one budget, one report, one conversation. I think we have had some success around what one budget means within our context, right? With the HOPE series, where, as a program, NICERI, we are pooling resources together, engaging states to incentivize a number of important priority actions. I think the next level of that is doing something similar on the TA side, and I'm pleased that the DHPRS and FCDO will be co-chairing that effort going forward, because there's a unique opportunity to enhance and coordinate, basically demonstrate resource convergence, resource consolidations, and better efficiency in terms of spend for TA. I think when you look at a lot of the data around RMET, there's significant opportunities in terms of pushing money more towards service delivery as well. And so the important momentum that we have enjoyed in service delivery on the one hand, but in better organizing spend on the other hand, I think puts us at a place where we need to double down in terms of scaling up and implementing. And I think that's what our focus really is now, right? We have done all the activation sessions in states for MAMI. this is about supporting service delivery. So we're going from that planning and principles phase to execution and delivery. We want to really move that needle to demonstrate that as a country, if we all focus towards the same North Star, better coordinate, better have a handle on our resources, be a bit more integrated and efficient, that it will actually improve outcomes. And I think for us that North Star is clear, not just improving maternal and neonatal mortality, but drastically crashing maternal and neonatal mortality. I wanted to end by, just really expressing my profound gratitude for the hosts of this event, because frankly, when no one was there, they were. They have played the ultimate sacrifices, being in the trenches, in states, as we figure out what a revamped AOP process looks like, as we figure out how that links to the budgetary process, and just true problem solvers, nimble, never complain, committed, and really the kind of partners that understands what a government and state-led approach should look like. And I want to use this opportunity to really honor you for being, what I believe is an exemplar partner in this effort to advance the Nigeria Health Sector Renewal Investment Initiative. So on behalf of the coordinating minister, I think there are 3 watchwords that he's asked to convey. One is, even after all this time in 2 years, urgency, right? We need to continue to keep that hunger, keep our eyes on the North Star, and demonstrate the urgency for delivery. The second is agility. He speaks a lot around how, even as we institutionalize, integrate, and hold ourselves accountable, we need to evolve and adapt our sector-wide to continuously being responsive to states. And the last piece is around delivery. I think we've had all the meetings, coordination meetings, now really to mobilize so that we can execute and deliver for our women and children in Nigeria.